Hello and welcome to Meet the Experts. Weekly, we bring to you experts to help you discover the latest and the greatest in wellness, anti-aging, and medical aesthetic trends. I'm Dori, Soukup, founder of InSPAration Management, and with me today is expert Dr. Lisa Vuich. Dr. Vuich is a speaker, author, clinical investigator, and educator, and founder of Renew MediSpa and the Renew MediSpa Training Institute in Dori, New Hampshire. Dr. Vuich is here today to share with us a couple of things. First, strategies for mastering clinical skills in less time than ever before, so you can set yourself apart from your competition so you are not constantly competing on price. If you are ready to start charging your true worth and start competing on expertise instead of price, watch this episode. Stay tuned. Welcome back. Welcome, Dr. Vuich. Thank you so much for taking the time to be with us today.
Thank you for having me.
Pleasure. Yes, it's so much fun. We have so much to talk about today. I would like us to start with first telling the audience why you opened up a medical aesthetic training institute. What drove you to do that? Because here you are, you're a medical doctor. You have your own medical spa, which is an absolutely amazing facility that you have. And then while you were building your building, you decided, okay, I'm going to also put a training institute. So tell us, how did that all happen?
Well, Dori, I had been training injectors from about 2013. And I was getting really, repeated requests for more and more trainings. Of course, at that time, we were somewhat limited in space. So when we were planning our build out, I really wanted to make a separate space for the Training Institute. And I'd actually formed technically the Renew MediSpa Training Institute back in 2016, but it really wasn't until 2019 that we had the separate space for it to really be able to host meetings if that's what we wanted to do, and to really be able to expand our availability. And of course, I wanted to incorporate more training, for a couple of reasons. First of all, myself, as a physician injector, I started back in 2005. I go to lots of conferences and different things through the years. And I always found that, or many times, the hands-on part was lacking in most trainings. There just wasn't enough time. Logistically, it's difficult. A lot of times you're in a hotel room. It's just not, it doesn't lend itself to an intensive hands-on experience. So that was number one. And number two, really, again, just sharing knowledge, because when somebody down the road from you has a complication, believe it or not, even though it's not your complication, it's going to affect your business. It affects all of us. And so if we can elevate the field and make more people more expert and safer injectors, safer procedure providers, better procedure providers, then we really benefit everyone.
Well, I think that's probably also what drove you, and in knowing you and how you are. Many people go to places and they learn how to inject in like one weekend, and they think now they're ready to open up their medical spa and ready to go and start injecting people. And you are so right in having those skills up to par is so important, because it does affect all of us. So what are some of the trainings that you want to focus on to help the industry as a whole and help other medical professionals like yourself?
Well, I think, what I look to provide, Dori, is I'm always looking really to fill a gap, right? I don't want to just reinvent a wheel that's already there, that's already available for people. So once again, our focus primarily is on private, semi-private, preceptorships, on custom tailoring training experiences to a particular provider. Someone will call us and say, I need these 5 things, this is what I'm interested in, and I need to get expert as quickly as I can, and what can you work out for me? Or people who've been to, 3 and 4 and 5, large group trainings, and still don't have the confidence or don't have the big picture, or still unsure about assessment or what to choose when, and that sort of thing. And that's really when that more focused, tailor-made training experience is really priceless in a way, in terms of getting you more confident and better at what you do in as little time as possible. So I do try to focus on those individualized experiences, and a la carte, kind of customized training experiences for either a single injector or a group of injectors from the same practice works out really well. Who might want to learn thread lifting, or show us how you do thread lifting with PRP, and we want to see how you do this too. And also we focus on the sexual wellness market as well. That's an area of expertise in terms of our training here, because we have so many of the devices and do so many different protocols. Well beyond just PRP injection, right? We have a lot of technology here as well for that. So that's another area of expertise. And finally, I also coordinate through specialty med training some mastermind meetings. And these are not, they do kind of combine procedure demos for certain procedures, especially sexual wellness and platelet-rich plasma related, but combine that with expert panel experiences where you can really, step into a meeting, see certain of these procedures, done according to specific protocols, and then really get exposed to a panel of experts who are all talking about the latest and greatest with respect to that type of procedure. So we call those mastermind meetings or mastermind conferences, much like you do for InSPAration management. And so those are more think tank experiences. That's what I like to look at them as. And we're planning, now that coronavirus is passing us, thank goodness, we're planning to relaunch that program very soon, with opportunities in the fall and winter for people to participate in a mastermind meeting if that's of interest to them and would be helpful.
I think that's great. As a matter of fact, you're going to be speaking at our mastermind meeting, because I see the value that you provide to all medical professionals and really everyone who cares about increasing their prices, stop discounting, and lack the confidence that you were just speaking about would be so important for them to actually be part of that. As you know, I'm big on education, whether it's clinical or business. It's really so important. And I think that's what's really been lacking in our industry, is exactly what you are offering, that one-on-one, the smaller groups, the more intense education. I think you are definitely filling a void, and I am so thankful that you're actually providing those types of training to individuals. Because as you know, we get asked all the time, where can I go for more training? And right now, you're my go-to person for having more training.
Thank you.
Absolutely, because it is so needed, and that one-on-one, I feel, would be worth every penny that they invest, to just go and watch you in action, first of all, and then learn from the experts, truly. And that's why I'm so happy that you're on the show with me today. So
thanks.
Besides the one-on-one, what else do they walk away with? Like when somebody, describe to me an event. So if I come to your place, to your institute, and I spend a day or 2 days with you, can you give us like an overview of what that time together is like?
Sure. When we're customizing a training experience for a provider, it starts with understanding where they're at, to start with. I mean, what procedures have they been offering? How long have they been offering them? What procedures do they want to add, or what populations, are they looking to attract? Literally, what are you looking, what would benefit you? So it starts really with that, understanding their needs. So that's quite different than just, going off and sitting in a hotel room meeting, right?
Yes.
And then it's really just kind of cookie cutter. Everybody's getting the same presentation. So we start with that, and then based on that, we identify dates in the schedule that will work both ways for them and for us. So that's, unique proposal number 2, I guess,
Yes.
is it's going to be tailored around schedules. You don't have to fit yourself into a specific conference date, right? Once we determine what the dates are going to be, we then tailor that experience to the specific requests of that provider. So if they want a complete sexual wellness immersion, type of experience, we make sure that they're going to see every single procedure that we do within that category in those 2 days. And then if they've included a hands-on component, because we do both observational and hands-on, if they've included a hands-on component, we make sure that within those days, they are physically performing those procedures on their own model with guidance. And they also have access not only to what I'm doing that day, but to what my nurse practitioner is doing, what my 2 nurse injectors are doing. And so they can actually, we can design it so that they bounce, in between me and the other providers here, depending on which procedures, because there are some procedures I don't, normally do, right. But they're still learning from the people who physically do them here at Renew. Like vaginal rejuvenation, I don't personally sit there and do Vivive or Thermiva or Shockwave, but my nurses do. Yeah. So you might as well sit with the person who does the procedure day in and day out. So we really customize that schedule for that participant or those participants to make sure that they walk away with everything they needed. And then, of course, we include protocols and forms and question and answer and marketing examples and all those, extras that really help you, especially if you're adding a service, to get up and running quickly and not be scrambling with how am I going to document this, or how am I going to consent this, or what should the wording be, or, there's, again, why reinvent the wheel? It's already been worked out. Just, use something standard and customize it to your practice. So again, very boutique, tailor-made, right? Customized, and trying to deliver as much information and as much experience as humanly possible. And then, another type of experience is like an event day that I'll do for providers. So for example, I had a physician from Massachusetts contact me who had started doing Botox injections. And I use Botox generically, not a brand name. And he'd been to a bunch of courses and just still didn't feel like he really had a good grasp of what was going on. So I had him watch my online didactic module in neuromodulators, which he did. And then he showed up for, what we designed as an event day for him. And I basically lined up for him 14 people. 14 faces to inject, start to finish. Wow. Look at the face, evaluate, determine the budget, decide on the placement, deliver the talks. Next. Wow. Boom, 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 14 times.
That's amazing.
Guess what? He left there, he was all set.
Yeah.
Right? He had the didactic, he had a lot of hands-on.
Yeah.
I connected him with the, one of the reps, for one of the companies, in his area. Got him some free vials to start with, because it's about relationships too. Yes. How can you foster relationships and maybe, oil the wheel a little bit and, kind of get someone to something a little extra with a little bit of clout if you can. And so, things like that. We do filler event days where we line up, X number of models. Now that's for someone, again, who we've already determined, already has some skill set, has done some didactic and really needs super duper intensive hands-on for a very specific thing, be it threads or filler or neuromodulator. Then we design your day and line up a bunch of models and let's do it.
Well, that's amazing. And I love the fact that you're combining online learning with hands-on learning. I love online learning, especially since this whole pandemic that we went through. But what are some of how does the process work exactly? You mentioned that you let them watch the online courses first that you've created and then come for the hands-on. Is that like the best way you like to work with them?
Well, that, for me, again, that works the best because I would rather focus really intensely on the hands-on when they're here.
Right.
Right. So, why not waste time, but you know what I mean?
Right.
Like, why spend
Yes.
time when you're physically here, going over didactic information that you could have sat on your couch and watched,
Yes.
right? It doesn't make any sense to me. I'd rather, and I don't consider myself a big online educator, but for certain things, I have developed an online module that I have them watch ahead of time, because then I know that the basic didactic that I wanted them to know before, starting hands-on, they've got it done.
Yes.
And then we can really heavily focus on hands-on, because you can't, there's a limit to how much you can do with online learning. I love it too, but at the end of the day, it's tactile, it's hands-on all day long with, aesthetic and regenerative medicine. It's just not as simple as write a script. You have to feel it. You have to have that motor experience, of performing the procedure to truly get comfortable. And it's, it's comforting to have someone who's done 1,000 of them standing by your side and ready to take hold of that syringe and say, okay, let me feel what tissue plane, you're in here. Okay, no, back up. I can feel that, you're a little superficial. Look, I'm going to change the angle of the needle now. I'm going to show you, now by changing the angle of the needle, what your depth looks like, and here's what you really want. And that kind of adjustment and correction on the fly. You got to be live, and really, I feel you have to be physically present there. Now, one thing I saw happen quite a bit during, the shutdowns and such is there was this trend towards online. Well, I'm not going to come to you, and you're not going to come to me, but you can Zoom meeting me in, and I'm going to guide you in this complex thread lifting procedure remotely. And I'm like,
no,
what?
That's crazy.
I'm not doing that. Like, I feel like, all right, now you've pushed the envelope. You've taken it a little too far. I mean, that's more like a Zoom, talk back and forth. But I don't see the real utility there for teaching a very tactile skill that way.
Yes. In your opinion, Dr. Vuich, how much training do you think someone should really partake in? Let's say they just went to the initial class, and for them to truly call themselves experts, how much training do you think they really should undergo?
I don't think you can put a number of courses or a time on that, honestly, Dori. I think it depends on the quality, of what's been done, and and having said that, you never stop training. I mean, I still watch training videos. I still, identify a few times a year someone who is at my level or above me, and I go spend a day with them. Why not? Because you're always, it's an exchange of knowledge. It's always fun. You're always going to pick up a nuance of something, or like, I wouldn't have done it quite that way, but I kind of like that, or so I never stop. Really, but I think
I'm the same way. You're always learning. Well,
I think if you've been performing a particular skill solidly for a year plus, you've got it going on. I don't know if I'd call myself an expert at that time, but the other thing is a lot of people are doing this part-time, not full-time too. So, if you're devoting yourself full-time to facial aesthetics, to sexual wellness, to whatever it is, you're going to get, master level a lot quicker than someone who's doing 1 day a week or 2 days a week. So I hate to put, a specific parameter on it. I think it depends on how quickly you tailor your learning experience and who you tap into. If you go with, low level, super inexpensive, super broad, like online training opportunities, you're not gonna get there anytime soon.
Yeah. The reason I wanted to ask you actually is because there's a lot of people that cheapen themselves because they don't have enough confidence in themselves. And those are the people that are really selling Botox at a very low rate and fillers. They barely make any money because they don't have that confidence. So what I really want our audience to gain out of this is that, you know, cheap is not good. And I'm sure you agree with me. You don't want to be the cheapest game in town. And if you're charging less because of the lack of confidence and education, then my advice to you is to definitely connect with someone like Dr. Vuich, get your confidence up, start learning more, so you can start charging more and truly get paid your true worth. And I think that's a big problem in our industry right now. And to get people to realize that you are worthy of charging more takes a little mindset shifting. I'm sure you've had people like that you've educated that are charging less and you're trying to get them to charge more. So any insight on that?
Well, I'll tell you something that's worked well for us. So I think this comes up most often with neuromodulators, right, with the Botoxes, because it's one of the, let's put it this way, it's one of the easier skills to learn, right? And so, you know, there's a sense that you can, I don't know what I want to say. It's an easier skill to learn. So there's a sense that, you know, you want to compete and you want to kind of like bring it in and you're willing to, you know, you want to grab those people because it's something you feel confident about. I guess that's what I'm getting at, right? You feel confident more quickly and you're like, okay, I gotta get these people in. I gotta get them in. And, you know, there's to some extent it's been commoditized, right? A little bit. And people around you are, you know, undercutting and charging less. And then you're trying to compete on price and, you know, everything else. So membership, right? Having a membership model where you allow your members to benefit from lower prices that are low enough that they're not tempted, you know, to go for a sale somewhere else, you know, but at the same time, they're very sticky to you, you know, because they've got money in their Renew MediSpa account, you know, sitting there waiting for them to use it, right? And they've always got a sale. They don't need to wait for a sale. They don't need to hunt for a sale. They don't need to be tempted by the place at one town over or that advertise for XYZ dollars, you know, per unit, because they're like, I already get it for nearly that. I'm not going to go try somebody else for just that, you know, little difference. So with our membership model, we actually have our clients, they choose a level of dollars that they're putting away each month towards their services. Okay, it's either $99, $199, or $299 a month. The levels are called, I think, Insider, VIP, and Elite. Okay, that money gets, you know, is tracked by our software and is added to their account, and, you know, it just accumulates there. As long as they're doing that, we allow them to buy their talks at a lower rate. They're not using their monthly dollars to do that, though. Their monthly dollars are used towards other things. Does that make sense? So if they want to just use their monthly set-aside dollars towards their talks, they can do that, but then they're just getting a 5 or 10 or 15% discount. And then they can use their monthly dollars. If they want to buy talks at the lowest dollar amount, they can purchase it through what we call our Talks Club, and they purchase 100 units in bulk at a lower price. And that lower price is better than the top discount price. So you see what I mean? That monthly dollar amount guarantees that they're doing other stuff here, okay? Generally, if they want the best discount on talks, it guarantees they're either doing facials or body contouring or laser or something, buying skincare, sexual wellness, whatever. They can use their monthly dollars and get their discount level on anything. But if they want the lowest price on talks they purchase it in the Tox Club, which only members can do.
Right.
And that Tox Club doesn't need a sale. It's always there for them. As soon as they use up their units, they can buy another batch. So the dollars in the bank sticks them to us. The Tox Club gives them an option to buy their tox in bulk at a low price, which is well in competition with everybody around us. So we found that method, and you could use this for anything, really, if you think about it, that method of keeping them sticky and making sure they feel appreciated for that loyalty really takes price shopping out of the picture, as long as you're delivering good service.
Exactly. Yeah. And that is so smart, because having a recurring revenue model definitely increases retention and patient satisfaction or guest satisfaction. We have so many members like you that generate actually 6 figures a month just from their recurring revenue model. I am a big fan of that. I practice it in our own business, and I have all members really practice it. So it's genius.
Well, Dori, we learned it from you.
Yeah. Thank you. But it's so important, though, for everybody, for the audience to realize that just keep doing discounting, keep doing promotions. It's just not very smart. What Dr. Vuich just shared with you is the smart way to go. So instead of doing discounts, or somebody asks you, when is the next sale? You say, well, become a VIP member and you will always have a sale. It's not a special occasion. So that way you're retaining them. So what she just shared with you is so important, you guys. And I hope that between getting your skills up and creating that business model with the membership model, then you have loyalty and you have higher retention and you feel like you're getting paid your true worth. So great advice you just gave. Thank you for sharing. Dr. Vuich, tell us a little bit more about your thought process behind doing your conferences that you're doing, your mastermind meeting, and how would people go about to sign up for that, or what do they need to do to be part of it, or what exactly is it?
Well, again, the mastermind meetings or conferences are really meant to put interested providers face-to-face with experts in the field, and even experts who are doing clinical research in the areas they might be interested in. So it's really trying to get people together in a think tank type of setting with movers and shakers, you know, who have newer ideas, sharing newer protocols, talking about what's worked for them best. You know, how much of this, how many of that, how many pulses a shockwave, how do you place them? All of these things, because, you know, there's always just sort of the protocol you're taught, you know, and then there might be some variations of protocols that people have found work better or have greater clinical success. So what we seek to do with the mastermind meetings is get some experts together, have an expert panel. That panel will address some of the common questions, et cetera. Certainly we have procedure demos. We discuss research in the field. You know, we can arrange some hands-on. I mean, sometimes around a mastermind meeting, you know, we'll have some like docs, let's say, who also want to do a training at the time. So we'll tack a training day, you know, either the day before the mastermind starts or the day after the mastermind ends. We can, you know, sort of piggyback so they're only traveling once. So that works well too.
Nice.
Currently, we're talking about doing one in October. I think that will be here in New Hampshire. We will probably do the next one after that in Florida, perhaps in the Miami or Delray Beach area. So we're working out dates. Again, we're just coming out of the whole, you know, Corona apocalypse here too with everyone else. So we're just starting to have those discussions. If you're interested, it will be, let me say this, it will be focused. This is not going to be a neuromodulator filler sort of thing. Okay. But it will be more focused on regenerative medicine. It will be more focused on platelet-rich plasma procedures, combining platelet-rich plasma procedures with other facial and body aesthetic procedures, like RF microneedling and CO2 skin resurfacing, et cetera. And certainly will be focused on the sexual wellness procedures as well, because we are now finally launching a clinical study for women, actually, here at Renew, combining some sexual wellness procedures as well as PRP. So we'll be launching that within the next few months. It should have started earlier this year, and then everything happened. So we are finally at the point to launch that study. So I'm hopeful that even by October, we will have some preliminary information to give people about how that clinical study is going.
Nice.
And we might even be able to entertain some other sites that might be interested in participating. So it really has that sort of research and experiential bent to it. Anyone who's interested in just getting on the mailing list about these two mastermind conferences coming up, or about future ones, we have done mastermind meetings in the past that did have a big facial aesthetics, component that did include fillers and PDO threads and things like that. So those do occur as well. If you're interested, you can contact info@specialtymedtraining.com. Okay, info@specialtymedtraining.com. Jill Swartz, the owner, is the one who is coordinating these meetings for us, and you can get put on a mailing list, and then you'll know exactly what dates are upcoming and what topics will be covered.
That's great. Well, it sounds like a really exciting conference, and you're targeting medical professionals who want to, again, elevate their education, their skills, their expertise. And part of being of a mastermind is about sharing and being able to be open and not just be the kind of person that attends and doesn't share. So that's what Mastermind really is all about. And I am so excited that you are doing something like this. And it's so needed, again, in our industry to have people be able to elevate. And I have a feeling, Dr. Vuich, that you're going to be doing it for all kinds of topics. And before you know it, you're not going to be working in your med spa at all. You're just going to be educating all over the place. So it's very exciting to see people passionate about education like you. Any last advice you'd like to give listeners who might be people that are just starting in the business, or maybe they've had a year under their belt? What are some of the things that they can do to really help themselves grow and become better at what they're actually trying to do?
Well, again, I think I would re-emphasize constantly learning, doing additional online training, but also, really reaching out and at least a few times a year going for that in-person experience where you'll be able to do some hands-on. And especially for things where, it might be something of interest that you might want to add. Maybe you're not even sure if it's something you do want to add. You won't really know until you've seen it, up and running. If you're having difficulty, from a business perspective, in terms of, launching new services or getting a membership model up and running. I mean, a lot of people struggle with that business, and I think that's in part why a lot of people, come to us too, because they do get to see, a multi-million-dollar medical spa up and running and functioning and see how the flow is and that sort of thing. But those resources are out there. You just, you have to tap into them. Certainly, we always recommend your course materials, et cetera, at InSPAration Management, because they're invaluable. Specialty med training is very good about, especially if someone's got a medical or functional medical practice and they're not doing well financially and they're trying to bring in aesthetics to float the boat and it's not going well. You need an expert to get in there and analyze your numbers and look at what you're doing. And I don't even know, Dori, if you're doing that sort of service now. Let us know. But you really need an expert to get in there and say, okay, here's what you need to adjust. Here's where you're, here's what you need to do, because that kind of business advice is harder to come by. Right. And it's not something you can just do an online course in it. You need someone to look at your numbers, your situation, interview your staff, figure out who's working, who's not, what's not working, what needs to change. It's very hard to do that when you're in the middle of it. Right. And not be just too close to the situation to see it,
Yeah.
from a different perspective. That's not easy. And there are, people readily available here who can help you do that.
Yeah. I'd like to actually offer everybody, if you're listening, you can get my book, my last book, How to Make Millions with Your Medical Spa. If you'd like to go get it from our website, it's totally free. It's my way to saying thank you to the industry. But if you don't know where to start with your business, or you need a financial assessment, you can always reserve a success planning session, and we'll be more than happy to tell you what we can do to help you. And if not, then we can always recommend you to anybody else that can help in case we can't. So those are all definitely very valuable things. And if somebody wants to know about the different online courses that you have available, they can just go to your training website. You want to share an email or a website with everybody so they can check out the courses?
Yeah. They definitely should contact me, lisa@renewmedispa.com. We are right now revamping our website, so things are going to flux and change a little bit. So it's the website for the Training Institute is medispatraininginstitute.com. But again, it's going to be shifting in the next few months because we're reorganizing and doing some stuff. So if you have questions, lisa@renewmedispa.com is the best way to contact me.
That's great. Well, thank you so much for being with us and for sharing your knowledge and for making a commitment to educating professionals in our industry. Thank you so much for doing that. Yeah, my pleasure. Thank you all for watching Meet the Experts. If you have further questions about the master your skills and begin charging more, and you can contact Dr. Vuich, like she just said, at her email address. It's lisa@renewmedispa.com. And that way you can be notified for future information about all the different courses that she has going on, the Mastermind conference that she has coming up, so you can really partake in all the great one-on-one and smaller group educational programs. If you like this episode, make sure you go to meettheexperts.com, comment and like the episode. And if you too would like to be an expert on the show, please apply. And all you have to do is go again to meettheexperts.com and apply. Thank you again, Dr. Vuich. And until we meet again, be well and be prosperous. Thank you so much for being with us, and thank you for watching.